So the population that I chose, the vulnerable population that I chose, was human trafficking survivors. And through this presentation, I will be outlining the health concerns from these survivors and these victims. And so just to go over the description of the population again, human trafficking is defined as the use, force, fraud, or coercion to obtain some type of labor or commercial sex act. Human trafficking survivors are known to be an especially vulnerable population due to many factors. Some of these factors can include trauma experienced by survivors, limited resources, and lack of support or help. So when I think of these survivors, I think of those that are put in very unsafe situations with a lack of control for what is going on and for themselves, and this makes them especially vulnerable. Just to go over statistics of the size of the population. So statewide, Utah had 90 human trafficking cases reported in 2019 with 207 contacts. On a more national level, in 2019, the U.S. had 11,500 human trafficking cases reported. So based off of statewide compared to nationally, Utah definitely has one of the lower amount of cases compared to a lot of states. I know when I was researching it, I think Nevada had the top amount of cases that were reported, but it definitely is still a concern here in Utah that needs to be addressed. Internationally, these numbers kind of shocked me, but every country kind of varies, but India has the highest amount of reported cases with 14 million victims. China with 3.2 million victims, and Pakistan with 2.1 million victims. So this is especially a problem internationally in a lot of other countries, but it also is a big problem in the US. So in comparison, Utah has one of the lower rates of cases compared to most states in the US. The US had quite a bit of cases, but still not close to as much as some other countries like India or China. So just to go over some contributing factors, addressing the social determinants of health, a lot of these apply to human trafficking victims and survivors. Some of these that can affect survivors and facilitate trafficking can include lower poverty, especially like low poverty areas. This can be even like third world countries. It can be more prominent due to the low poverty. Also gender, a lot of the time, obviously not all the time, but a lot of the time it is females that are trafficked the most. And with age, a lot of the time it's younger women and children. Also culture or ethnicity, lack of policy or enforcement, lack of police or law enforcement in the area. And again, the area based off of the state or country, like areas like India and China, it's a lot more prominent than even like the US. Some specific concerns. I think one of the biggest concerns for this population is safety. Those trafficked are usually put in very unsafe situations that can include isolation, abandonment, and restraint. Again, these victims usually have a lack of control for what's going on, and they're not able to care for themselves properly. Some physical concerns, obviously a risk of physical abuse and sexual assault, malnourishment due to lack of food and water, lack of clothing, lack of health resources like hospitals, doctors, psychosocial. Again, those put in these situations, victims are usually, they usually have a lack of control for the situation, and a lot of the times those that are trafficking them are very controlling with them talking to other people. So this can be seen by avoiding eye contact with others and interaction, or like responding in ways that seem scripted by the traffickers. Um, some economic concerns, obviously like a lack of possessions, personal belongings, and unstable living environment. A lot of times like they can be homeless, and lack of food and water, like stated earlier. Some root causes. I think there's a lot of causes that can contribute to the situation. I think a lot of them pertain to the offenders. So the main one I thought of is that human trafficking offenders want to manipulate others for sexual or labor acts in an attempt to show control. So these offenders are usually very controlling people. They want to manipulate others, and yeah. Also, human trafficking isn't monitored enough in certain areas, making it more prevalent. Again, like it's not obviously monitored as much in like third world countries, making it a lot more prominent. So, going through the hierarchy of needs, I was really trying to go through them and see what ones were met and what ones were unmet, but everyone I went through, I felt like they were that all the needs were unmet, which is obviously a big concern. So physiological needs are unmet due to the possibility of limited food and water, the possibility of physical injury or abuse, lack of sleep, self-care, all those things. Safety is obviously unmet due to the situation. Being in unsafe situations, possibility of like being kidnapped, placed in isolation, lack of control by the victims, being forced to do certain things, whether it be sexually or labor acts, love and belonging. I feel like this is definitely unmet because the victims are usually completely taken away from their families and their loved ones. They probably feel very isolated and alone. Self-esteem also is unmet. I feel like because it can be expected that survivors have a low self-esteem due to the trauma that they have experienced and feeling alone and isolated. Self-actualization, unmet. I feel like these victims are kind of stripped from all the attributes that they have, all the good qualities, are just kind of stripped from them when they are trafficked, which is very sad. They're not able to be their true selves. So this is obviously a very big problem that none of these needs are met. These needs are meant for proper functioning, and the fact that none of them are met means that these victims are not functioning properly in any way, and this is a very big concern that needs to be addressed. Other concerns, communicable diseases or infections. A lot of the times these victims are at an increased risk for sexually transmitted diseases such as HIV or AIDS due to sexual acts, and obviously like unprotected sex. Also infections due to unsanitary practices, whether it be sexually or in other ways. Also infectious diseases such as tuberculosis and many other things. So unfortunately, not much can be done to prevent the spread of these diseases and infections due to the current situation and the victims not really being in control, which is a very big problem. So not much can be done in the situation itself, but there can definitely be things that can be done after the case for getting these victims help, physically and emotionally and everything. And then non-communicable diseases or infections. There's a lot that can fall into this category, but I feel like malnourishment is a big one. due to, of course, again, the lack of food and water, also dental problems, chronic health issues like cardiovascular disease, respiratory disease, many other chronic health issues, undetected or untreated diseases due to lack of health resources, acute or chronic pain. This can be due to the situation, pain that is inflicted by those that are trafficking them, bruises or scars, again, from sexual or from physical abuse, and then pregnancy from unprotected sex, and infertility due to untreated STIs. So again, with a lot of these, they can't necessarily be prevented in the situation due to the situation and being in lack of control, the victims being in lack of control. But there's definitely a lot that can be done after the case, with getting them appropriate health care and the help that they need. So going to self-care and self-harm, these are definitely big issues, and victims are at an increased risk of self-care and self-harm when in these situations. So with self-care, victims may not be able to properly care for themselves due to the situation. They might not have access to appropriate hygiene and other things, making this very difficult. A lot of the times, like, they can't shower, they can't brush their teeth, they can't really do anything to care for themselves, which is an issue. With self-harm, when I think of this, I think a lot of it is after the case, after they've been trafficked. But victims can be at an increased risk of self-harm, especially if there are psychological impacts from the trauma. There is little research on this impact of self-harm and victims of human trafficking, but it is still known that self-harm and suicidal ideation can be a very big issue in these victims. Let's see. So self-harm can be prevented through proper psychological help and guidance after the case. Then risk for self-harm by or to others. I didn't really think of anything like to others. I don't feel like a lot of the times that's an issue, but definitely they're at an increased risk of harm by others. So as outlined earlier, they're at an increased risk of harm, physically, also like emotionally. This can present as physical injury or physical abuse, as well as sexual abuse. Physical abuse, again, like stated earlier, can present as bruises or scars. Also neglect, which can present as like lack of malnutrition, lack of food and water, shelter, other resources. These victims can also be greatly harmed emotionally and psychologically, presenting long-term effects such as PTSD, anxiety, and depression. So these are the references for all the articles that I used throughout this presentation. I thought it was very interesting to learn more about these specific concerns for this population. It made me definitely more aware and think of some ways that that I can do my part to help with this situation. So, thank you.